The reason why I don't delve deep into a family history of hair loss is that I've found it to be a red herring. I know that as the president of the American Board of Hair Restoration Surgery, part of my examination that is critical to test an individual who is a candidate to take the exam is that that person must inquire about a family history. You said, well, why is that the case if you don't believe in that? Well, I understand that the vast majority, probably 99% of hair surgeons out there do believe that taking a history of hair loss in the family is important. The reason I don't believe so is that I don't believe that it tells me anything. Now, you said, well, what if everyone in the family is really thinning? Well, if this person is not thinning, that already tells me that I'm not so worried per se. Now let's clarify this. If you've got someone 20-some years old, okay, let's say they're 22 years old, already starting to rapidly thin, and you tell me that the family history is negative for advanced hair loss, that means nothing to me. I know this person is going to progress with thinning and possibly very badly because he's so young. You can't feel reassured that that family history is not significant for advanced balding. That just doesn't mean anything. Now, let's take the flip side. Let's take a gentleman who's in his 50s that is just, with moderate degrees of hair loss, but his entire family is incredibly bald, like Norwood 6'7", the most advanced baldness. I don't care. I go by what that person looks like because that person and his track record is defining for me where his hair loss is. He said, well, why would a family history not be important? The reason for this is that, hair loss is genetic, but hair loss does not follow a very clear genetic pathway. For example, I have not really had significant hair loss in my scalp. I'm a Norwood 2. I don't have a prepubescent straight hairline. I have a high forehead, but I still have a very good frame to my scalp at 52 years of age without significant miniaturization, and I'm not on medical therapy. But my mother's father was a Norwood 7 completely bald horseshoe by about 40 years of age. So if I saw that, I would be so worried that I would have to be on medical therapy. I'd have to start right now. Maybe I even get a hair transplant. But why? I'm not really losing hair. So this is the problem, is that family history doesn't tell me anything. I've had genetically identical brothers have different types of hair loss patterns. They both have hair loss because there's a genetic predisposition, but there are other factors going on, such as, you say, well, if they're genetically identical, now you're going crazy, Dr. Lamb. Why would they have the exact same? Why won't they have the exact same hair loss pattern? Because diet, smoking, exposure to environment, all these factors can play a part and are called epigenes. But yes, if they're an identical twin, they're one having hair loss, other one's almost definitely can have hair loss to a certain extent, unless that person had chemotherapy or some other reason for the hair loss. But even fraternal twins that have pretty different hair loss patterns, that have different genetics, not entirely different genetics, but somewhat different genetics, actually can have radically different hair loss patterns. And example is one of my colleagues who is a hair transplant surgeon. He and his fraternal twin, he actually has a full head of hair. His fraternal twin is very, very bald. And so, it's not wrong if a hair surgeon that you're having a interview with asks you extensively what your family history of. I just would caution you and caution the hair surgeons, even listening to this podcast, that the validity of a family history of hair loss is just so limited, in my opinion. If I'm seeing you're having hair loss, a certain degree of hair loss, degree of miniaturization at a certain age bracket, that's how I define your future problems. I don't define your future problems based on anyone in your family because it's just too much of a red herring for me.